Hello, I'm Alan Critchley and I write Safeguarding Adult Reviews. This one is about Glenn. Glenn died in hospital at the age of 83. He'd been an accountant and he seems to have worked in one form or another until shortly before his death. He had two daughters and lived at home with his wife, Ethel. Ethel had been diagnosed with dementia and Glenn was showing signs of dementia as well. At the time the review was commissioned, Glenn's wife was alive and in a care home. This review is therefore about Glenn, and unfortunately his wife's voice is missing. From the records provided to the review, it's not clear which was the carer, and it's likely that both cared for each other to the best of their ability, but that this was getting difficult as they got older. One of their daughters, Abigail, supported her parents as best she could, but she lived some distance away and wasn't able to do as much as she would like to have done. Now, apart from routine matters such as COVID-19 vaccinations, agencies weren't involved with Glenn until August 2021, and from that point onwards he seems to have become more confused. His wife had a period in hospital and he was unsure where she was. A memory test undertaken by the GP showed a moderate impairment indicative of dementia. The couple's daughter then requested a care needs assessment and the referral for this was accepted. But as a referral was also made to the memory clinic, the assessment wasn't followed through by the family as it was thought to be unnecessary at that stage. The appointment at the memory clinic was reliant on Glenn making the appointment and then attending. By this stage, he may not have been able to undertake this, or he may not have wanted to. Given that there was no reason to doubt Glenn had capacity, he was able to refuse the memory clinic appointment, albeit it might have been unwise for him to do so. Given that Glenn hadn't been in touch with the memory clinic, they closed the contact, letting the GP know. Over the following months, some more health appointments were missed. Glenn also called the police on several occasions to report intruders in the property. Initially, the police attended, but once a pattern emerged that there were no intruders on the premises, they let the ambulance service and/or Glenn's daughter know that things were a bit amiss. Abigail then again requested a care needs assessment in January 2022. Due to the sickness of the social worker, this wasn't completed. However, a welfare visit did identify the need for a complex capacity assessment to assist with a potential application for deputyship and for any decisions required in relation to where Glenn might live and/or services he might receive. The following month, the GP again made a referral to the memory clinic, making the point that further refusal of services might not be capacious. By then, the house was cluttered and both Glenn and his wife were struggling with personal hygiene. At this point, a referral for self-neglect could have been made and could have brought the agencies together. The daughter could have been included in this, and so that agency and family help were gathered together and their expertise and knowledge were pooled and that they worked together. Glenn didn't attend the memory clinic, and in March a paramedic practitioner from the GP surgery visited at home to see and assess him. Glenn wouldn't let him in, but spoke on the doorstep. On the following day, a team leader from Community Mental Health for Older People Services and a specialist doctor visited the house. Again, they weren't allowed in, but from a conversation on the doorstep, it was determined that the risk of self-harm was low, risk of neglect was medium, and with regard to risk to others, there was some doubt about whether Glenn could care for his wife. The plan from this visit was to discuss further with the daughter and to call a multidisciplinary meeting and to discuss with the KMPT safeguarding team. A care coordinator was also allocated on the following day. That was good practice. This plan would have been helpful, but unfortunately it wasn't put into effect immediately, and later that month Glenn had a fall outside. A neighbour called the ambulance, who made a best interests assessment and took him to hospital. From there, the plan was to discharge him to a care home, but very sadly he died in hospital. Now, the recommendations from this SAR Glen are, first of all, self-neglect, including in couple/intimate relationships, that the self-neglect procedures are refreshed to make it clear that people unwilling or unable to care for themselves can be covered by the procedures, and that all relevant agencies are reminded that they can call a multi-agency meeting where it might be beneficial to do so. The procedures should also provide advice with regard to a recommended pathway where there are two or more people at risk of self-neglect in the household, and how the needs of each impact on the others. The second recommendation was about legal literacy and making safeguarding personal, and that's to remind practitioners and agencies that making safeguarding personal is a core component of legal literacy and should be considered in the context of proportionality, the least intrusive response appropriate to the risk presented. The third and final recommendation from this is advanced decision making, that agencies are encouraged to agree a system for recording advanced decisions with regard to care and welfare. This should be done in collaboration with people involved and, if appropriate, their families. So that's a brief resume of Glen. You can read more in the full report or the learning briefing. Many thanks.